At Meridian, our quality department provides updates to staff via emails, newsletters, and all sorts of meetings. I'm sure your organization does as well. We call our communication segments Quality Matters because, after all, quality does matter in everything we do. So, for the next few moments, I'd like to share with you what we call our burning platform for improvement. And for those of you who don't know what a burning platform is, it's a decision point where if a platform you're standing on is on fire and it makes more sense to jump off rather than staying on the platform. And what does the burning platform mean for us? The changing landscape of healthcare. We've listed a few of the changes we're experiencing, but I'm sure we could all name a lot more. I'm going to talk briefly about each one of these changes in a moment. But first, raise your hand if you love constant changes. That's what I thought. So let's start with the addiction crisis. I'm sure you're all aware that the United States ranks #1 in opioid prescriptions, and in fact, our nation's leaders have even declared it a national crisis. According to the CDC, on average, 130 Americans die every day from an opioid overdose. Now, sadly to say, in our home state of Indiana, we have the 5th highest opioid abuse rate in the country. But as Meridian's part to help counter that epidemic, in 2017, we opened our first adult rehabilitation facility. In 2018, we opened our second, and we're now exploring the possibility of a third. Now, during this time, we're tracking the length of stay, engagement in therapy, and whether patients are achieving their service targets. We've tried to follow up post-discharge, but honestly, these folks are very difficult to track. And another area driving us toward improving services is, of course, the patient experience. As a result of one of our initiatives here at Meridian, we've implemented a new and improved system for more accurately capturing patient satisfaction scores. Furthermore, we've made individual office and provider scores more transparent across the Meridian system. To help support this endeavor, we've created additional education and training for staff moving forward for this. Because through creating transparency, we believe you're going to achieve greater satisfaction. More specifically, we've achieved a 95% satisfaction score rating amongst our behavioral health patients. And secondly, we've achieved a 99% satisfaction score rating amongst our providers. Now, one of the outcomes of our projects was creating steering teams for our service lines in order to be able to track and better monitor outcomes, including patient satisfaction scores such as this. Now, let's talk about another big challenge facing healthcare, which I'm sure is no surprise to anyone: the evolution of technology. I'd like to tell you all that we're keeping up with this as much as we'd like to be, but unfortunately, we're not. However, what we've achieved in the meantime is nothing short of impressive. We brought telepsychiatry to our patients and need broader access to our services in our rural offices. Another big project we did resulted in the use of technology to complete psychiatric assessments in rural hospitals. This helped alleviate the need for our LCSWs to have to travel to the hospital, interrupting patient care during the day and family time during the night. We're still rolling this one out, but one of the outcomes we're expecting to see is a reduction mainly in staff turnover. Another project we did was the introduction of a web-based service to track patient outcomes in our behavioral health. We're using a product called My Outcomes. This is going to help track and monitor patients' progress, which has also enhanced our clinical supervision. And speaking of outcomes, for a long time, the outpatient world's been able to enjoy the benefits of a fee-for-service model, but no more. And rightly so. It's not just payers that want to see outcomes, but patients are getting more savvy as well. Meridian's response to this has been to implement a more robust methodology for tracking outcomes and making more improvements using a focused PDCA, which we'll talk about here in just a moment. Now, as with every healthcare organization, we have regulations. As an integrated healthcare system, we have multiple surveys and audits every year. Honestly, sometimes we do great. Other times, we have to implement corrective action plans. Our quality department oversees these action plans, which often result in a project that will need to be managed and sustained over time. Understanding the root cause of why something isn't working right and implementing sustainable solutions is the key to eliminating those effects. And as an integrated healthcare system, we take pride in that. We started out as a behavioral healthcare organization, but in 2010, we added primary care. In addition to primary care, we've added pediatric care and rehab, women's health, senior health, and most recently, dentistry. And now over the years, our behavioral health has grown substantially. In addition to the traditional psychiatry and therapy, we also have 3 inpatient psych units, 2 inpatient addiction centers, group homes, HIV services, foster care, and our Connections program for the dually diagnosed, just to name a few. Managing transitions between care and assisting with the creation of solutions for whole person health has become a primary linchpin in our performance improvement team. We utilize PI to support the ongoing functions of our care across our Meridian system. And finally, the pivotal question: how to do more with less. At Meridian, we like to think smarter, not harder. We're all facing shortages, so how do we respond? We have to do things differently than the way we've always done them. After all, what's the definition of insanity? Doing the same things the same way and expecting different results. There's several really great performance improvement programs out there today. In a few moments, we're going to talk about the programs we've experienced success in using. However, we're an organization that believes in continuous improvement. I'm going to share with you a simple plan we started with, but we're already looking at enhancing our project management portfolio and doing some of our first lean projects. And as the old proverb says, fail to plan, plan to fail. Now, most organizations have found out, unfortunately, the hard way that creating a committee around a problem doesn't always work. And as far as managers go, most of them are already overburdened. They're adding to their workload, and by assigning them to fix it, doesn't always work either. Furthermore, it doesn't help create standardization or sustainability across an organization. We need to be more intentional about solving our problems and moving measures. Bottom line, we all need a plan.